In recent years, obesity has become a global epidemic. Its impact on our health has put us at risk for many serious diseases. Heart disease, stroke, blood pressure, diabetes, and inflammation are just some of the conditions affected by our weight. Excess weight also has a direct impact on our ability to breathe. No one knows better than Ed Newsel, board-certified nurse practitioner at Allergy, Sinus, and Asthma Family Health Center. He's been helping patients in the villages breathe easier for almost 20 years.
We know that the more weight we carry around, the more difficult it is for us to breathe appropriately. I ask a lot of my patients, and I try to do it in as kind of fashion as possible because I come from that particular point of view myself, being overweight. And I noticed it was to the point to where I just couldn't move. I could hardly do anything without getting short of breath. You can't bend over and tie your shoes. You end up having to put your shoes on the side of the tub or on something so you can tie them. It dramatically impacted the quality of life. So weight is a big problem. And so the more we can do to watch that and control it, the better off we're going to be. Lifestyle is a big factor, and we all want a good quality of life. We get together and food becomes a big part of it. And so we have a tendency to eat a lot more than we ever have. And I have had many patients gain significant amount of weight up here. And the more weight they gained, then the more short of breath. And they started to limit the things they do. So as we become more social and we're eating more, we should be exercising more. And I tell a lot of my patients that if you want to get off some of your medications, then let's get some exercise. The more exercise you do, the more healthier we become, the less we need medications to compensate for some of the things we see. So the lifestyle up here has a lot to do with it. A lot of the individuals here we talk to, and we say, well, if you presented the way you are now like you were 20 years ago, you'd probably be in the hospital swearing you're dying because you just got used to it over the last 20 years. And we just get used to the various changes in our life. And so as healthcare providers, we can go out there and educate people in the various disease processes, whether it be allergies, whether it be pulmonary, whether it be endocrinology, all these other diseases, and help them understand the disease process. Nobody wants to have COPD, and nobody wants to be a diabetic. And I think in helping them understand the process, they're more acceptable to the treatments.
To get in touch with Ed Newsel and the staff at the Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click the Out of Breath tab on our homepage, yourhometownhealth.com.